Good afternoon, everyone. Welcome to the Jefferson County Health Department Board of Trustees meeting. This is March 26, 2026, and it is roughly 4 p.m. If we could make sure that everybody please silence your devices so we can have a interruption-free meeting. And at this time, I'm going to ask everybody to please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you to everyone. I will now call this meeting to order and ask for the roll call.
Mr. Pigg.
I am here.
Dr. Henry.
Here.
Ms. Stidham.
Here.
Mr. Deal.
Here.
Ms. Taylor.
Here.
A quorum has been established. Ms. Henry, would you please read the mission, vision, and purpose?
Sure. The mission is to promote positive health outcomes through delivery of foundational public health services. Our vision is a healthy Jefferson County, and the purpose of the health department. The JCHD is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
As we move forward, I do want to make an announcement or kind of a request for everybody here. I know I was made aware that apparently some of us are not speaking into the microphones well enough for other people to hear you on the internet. So if we could kind of make a conscious effort to correct that, it would help everybody moving forward. So thank you. Next on the agenda is approval of the agenda or any amendments thereof. Do I have amendments or an approval?
I have a motion to approve the agenda as written.
I'll second.
Having a first and second, is there any discussion on the motion? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome guests. We have two in the audience, so I appreciate it very much. Mr. Lederbrand is here, of course. Next on the agenda is approval of the minutes and expenditures. So we have approval of the January 2022-26 meeting minutes. Do I have a motion for those?
I'll make a motion to approve.
I'll second it.
Having a first and second, is there any discussion on the matter? Not hearing any. I think we had some people that weren't here. Do we know
That was me.
who has to abstain? I just want to be sure. Okay.
Yep.
So all in favor of the approval of the January 22nd minutes, please say aye.
Aye.
Any opposed? Motion carries. Approval of the February 26 meeting minutes. I know I was not here, so I don't know if others were, but do I have a motion for that, please?
I'll motion to approve.
I'll second it.
Have a first and second. Is there any discussion on the matter? Not hearing any. All in favor, please say aye.
Aye.
Any opposed? I abstain.
I abstain.
Okay. Did you get that, Gina? 2 abstentions, all right. So we have approval of the February 26th expenditures for $82,051.33. Do I have a motion, please?
I'll make the motion.
I'll second.
Having a first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
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 Any opposed? Motion carries. Now is the approval of the February 26 electronic payments for $445,043.77. Do I have a motion, please?
I make a motion to approve February 2026 expenditures.
I'll second.
Having a first and a second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Next is pre-approval of the April 26 electronic payments for $585,097.00. Do I have a motion, please?
I'll make the motion.
I'll second it.
Having a first and second, is there any discussion on the matter? Not hearing any,
sorry,
excuse
I
me,
had a
no, yes, sir.
What is the Amazon line item for?
Amazon expenses, Probably
sorry.
supplies and things for Amazon expenses.
Okay. Okay, thank you.
Is there any other discussion? All right, so this is pre-approval of the April 26th electronic payments, $585,097.00. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next on the agenda is the Public Health Report, Director's Report. Mr. Sykes, the floor is yours.
Okay, I think I talked about this at a couple of past board meetings about our attending the Capitol Day. That did take place March the 10th, sponsored by Mosifi, and 4 of us went to the Capitol Day. There was about 30 other public health professionals there representing 20 local public health departments. This was something new for many of us that went, but I think we had a very enjoyable day. We met with both of our state senators and 3 of our representatives. We also met at what was his name? Patton. Is it Patton? The House representative. Anyway, we met in his office. We were able to discuss our various things that our health department does. We gave out our information pamphlets that Brian put together, talks about all the programs that we do here at the health department. We discussed the budget from the Department of Health and Senior Services budget. The governor has put in about cutting some of the funding on that. We also talked about a House bill regarding permitting of mobile food vendors. So we were able to talk directly to some of our representatives and make some connections there. I felt like I found it very interesting, very helpful. Everyone told us that they really appreciate advocacy from local health departments and encourage us to continue to doing that. And I think that we feel like this is a good start for us. Did you have a question?
Yeah, Steve, what's that House bill about?
It's there's a couple of different bills floating around. This was mobile food vendors that they would be permitted through the state and not local. So yeah, it would take our authority away to do permits within our own county. I don't see it going very far just because I don't think the state's set up to permit. They don't permit any type of food vendors now. So I don't know. I think it came out of the Kansas City area. Some vendors over in that section of the state didn't like. It's more, from what I understood, several of their, the locals can be, like the city may permit them, and then the county permits them, and then this city permits them. And we don't, in Jefferson County, it's just one permit from the county health department.
Right.
Now, they get charged fees for attending an event, but that's not the permit, that's the event itself. So I'm hoping it doesn't go anywhere, but we did get to discuss that. A little bit of an update on the rural health transformation program. I've been talking a little bit on this. There's still not a whole lot to say, other than it looks more and more like that Jefferson County will not be part of this funding because we are being considered as an urban and not rural, and this is really focused on rural. I think there could be some argument that Jefferson County could be considered rural, especially the southern part. But I did speak to Daniel Bogle. He's the Health Policy Director for Department of Health and Senior Services. Any preliminary map that he has seen does not include Jefferson County. So we're thrown in with the larger counties, St. Louis, Kansas City. I believe there was 10 others that were not included. And this was where they would set up regions, and the regions would have hubs within those regions for this funding to flow to. It's really to develop the rural health. A lot of hospitals that have been closed in the rural areas, trying to bring some more funding back into those areas. So there's been some surveys put out that we weren't able to fill out because we're not part of it. So more and more it looks like that we would not be eligible for this funding. We've completed an update of our operations manual. If you remember, we've had 2 or 3 changes that were made, and so those have been added. One of the recent ones was we updated our payroll process for non-exempt employees. Instead of being paid once a month, our non-exempt employees are now being paid semi-monthly. Exempt staff are still monthly, but they're once a month for being paid. So we had to update our operations manual on how that works. Also, we had to our investment policy. The company that handles our investments asked that we re-up that. We have to do that every 3 years. So that was signed and put back in. And then we also, if you remember back in November, I believe it was, yeah, we did a new purchasing policy. And so we got all that put into our operations manual and got it up to date. And that's my report. Any questions?
I do have one. Mine is specific over our food vendors, mainly our food service places. How are we doing with those licensures? I know you guys were.
Yeah, well, I think were you here?
I was not here last,
Okay.
so
I was gonna
I
say,
apologize.
You remember the statistics?
I think that we had less than 30 left, but those 30 weren't necessarily open and operating. Some of them are summertime,
Okay.
concession stand, stuff like that.
All
But
right.
everybody that is operating right now has a food permit.
Okay. Very good. And then I do have one other question. I'll just hold in a minute. Does anybody have any questions for Mr. Sykes? Any others? So is there any question from the trustees on the program reports? I have just one for Melissa, real quick. It's really just more of a intuition or question for you. I was just looking at the number of influenza cases and how it appears that there's not that many, but yet I know a lot of people that are being sick. So is there something else running around besides the flu and COVID? Is there some other creature? Yeah. It just seems like there's a lot of people sick.
Gina may be able to answer from the CD perspective, if we've seen some other numbers from CD.
We haven't. The flu and COVID are the only ones that are reportable, but anecdotally, I know we're seeing a lot of different stuff. The same with, you talk to anybody and they've been sick
Okay.
with something.
All right, that's all I had. Just notice that. Oh, sure.
What about monkeypox? I see that's in Missouri, not in the Jefferson County area.
As of this moment, I don't know of any cases in Jefferson County. I don't want to jinx us, but yes. Yeah, they have reported, I believe, 2 in Missouri.
Any other questions? All right, I'm going to move forward. Next on the agenda is public comments. I don't believe we have anybody looking to make any comments today, so we're going to continue on. So we have old business now. It is the approval of resolution number R260214. And this resolution is appointing Mr. Sykes as the county health officer. I believe once we approve this, it goes forward, correct?
It's already been approved.
Oh, we're just backing up them.
We don't need to approve it. The county has approved him. It's in the original.
Well, then we'll just announce that it's been approved by the county council. All right, moving forward. New business, this is to open our automated security gate bid. So if you want to go ahead, Mr. Sykes, and take that over.
So what we're going to do here, we went out for bid on putting a closure on our gate. We didn't put that in the original plan when we built the building. So due to the amount that it was, we went out for bid following our new process. Today, we will open and record the bids. Typically what we do is then we'll go back, I'll have Mr. Crawford go through these and put it in a spreadsheet, and so we can compare them and then come back to the board with the best bid that we received. So I'll let you, which one was first?
This one was first, March 25th.
Okay.
It's glued in. So Master Communications, Inc., and Master Communications proposal price for the above scope of work is $37,504.85.
Can I ask, is this the gate or just the opening mechanism, like the locking mechanism?
It'll be an automatic gate. and
Okay,
what we're
so the
trying-
gate itself.
Well, the gate's up, but it'll be the closure for it, but then it'll have the automated, like a badge pass, or you punch it in, so it's got to be connected to the internet and everything like.
Okay.
The second one is March 26th. And it's Kodiak Equipment Services, Inc. Do you see it out? Oh, here we go. Sorry. Total estimated bid, $11,579.39. Do I need to do the add-ons?
There's several add-ons. I think this is where we'll get it,
You'll have to
put it,
come back,
make sure
yeah.
we're comparing apples to apples here.
Yeah, $20,000 difference, that's significant.
Yeah, I think,
That's the only total I see.
yeah, that's the only total, so based on that. But Steve's, we'll put that in a spreadsheet. We'll be able to see what's going on with that. If there are add-ons or whatever that would add to that price. That's,
We only had two bids?
only had two bids, sorry, yeah.
No, that's all right, I'm fine. All right, so you're gonna go and figure all that out and come back to us.
Next board meeting, yeah.
All right. Next on our agenda is the first reading of the resolution authorizing Jefferson County Health Center to provide mosquito control services to the city of DeSoto, Hillsborough, and city of Kimmswick pursuant to the intergovernmental agreement, and authorize chairman to execute intergovernmental agreement. Do I have a motion to approve this so we can have a discussion?
I'll make motion to approve.
Do I have a second?
I second it.
Having a first and a second, we will now open the floor for discussion. Anybody have discussion points?
This is identical to the one we do every year with the agencies. No changes.
Yeah, there was a slight change to the reimbursement cost just due to the annual merit increases. So that was the only thing that changed.
So the municipalities pay a set fee, or how much is that?
Yeah, each of them pay a set fee, and it is just a direct reimbursement for the fringe and salary for the person operating the truck, 2 hours of admin to get routes and everything together, and then a mileage reimbursement and a chemical cost
And that's a
reimbursement
per treatment.
per treatment.
Okay, and that can vary,
Mhm.
right, okay. Do they have to request a treatment?
I believe we have a standing order with them. I think it's once per month. I could be wrong on that. But the program works with the municipality to see how many times they want, and we work it into the rotation.
All right, so I'm going to, pardon me. There's not anything, anyone else have any questions or comments? I'm going to read at least the first paragraph on the intergovernmental agreement. So this is intergovernmental cooperation agreement regarding the mitigation and abatement of mosquitoes. This agreement is made and entered into the 30th day of April 2026 by and between the city of DeSoto, and of course, that's going to include the city of Hillsborough and the city of Kimmswick. There are three separate, but they're all written the same. Herein that the county will do it, and the city and Jefferson County Health Department will collectively of parties. I know it's written weird, but that's the way it's written. So, any other questions?
I have a quick one. So if people, I know there have been people that have called to request not to spray in their area. How does that work and who do they call?
There is, it's not up yet. Normally, around the 1st of May, we will have our request list.
Okay.
But they can submit on the request list and then put in the note to not be sprayed.
So does that go for the whole street, or do they stop and start in front of their house, or how does that work? Do we know?
I feel like 150 feet is the number that's in my head,
Okay.
but I can get back to you and figure out what that is.
Okay.
But I know that Scott's very diligent to make sure that he acknowledges that
Okay.
no spray list.
Okay, thank you.
Is there any other questions? Not hearing any, again, this is the first reading of the resolution authorizing the health center to provide mosquito control services to the city of DeSoto, city of Hillsborough, and the city of Kimmswick pursuant to the intergovernmental agreement and authorizing the chairman to execute the intergovernmental agreement. Roll call vote, please.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Yes.
Ms. Taylor?
Yes.
Motion carries. Final reading will be next meeting. Next on the agenda is the CDC and FDA update. Steve, what do you have for us?
Yeah, little update, the ongoing saga with the vaccines. Here recently, the American Academy of Pediatrics did sue, went to court with Robert Kennedy on the ACIP and some of the mandates or considerations that they put out, and the judge ruled in favor of the American Academy of Pediatrics to put a stay on the members, 13 appointees of that, of the 13 members, and also the revised CDC childhood immunization schedule that they put out. Really, again, this has not changed anything that we're doing. We're still doing the same thing. The state director put out a release in Missouri. Vaccination requirements for child care and school-aged children remain unchanged. There's no current plan to modify the current regulation until and unless there is a requirement or new evidence suggests a change. So this is not affecting us on our operations here at the health department, but there's still that ongoing back and forth on the federal level. That's my only update I have on that.
Any questions for Steve?
I don't, but I did speak with them, just so that everyone knows that families that feel that they would rather use other ways of treating illness other than a vaccine, my grandson included, are not able to get any kind of health care. Pediatricians are denying well visits if they do not vaccinate, and that's literally every pediatrician in this county. So I did bring it to administration attention, and they're working on a list. But yeah, my grandson, 7 weeks, does not have a pediatrician because my daughter doesn't want to vaccinate right now. So she's been denied care.
So they won't see them at all as a
No.
patient?
No. And so my concern is, isn't that a public health issue that we need to be addressing? Not that we can address our pediatricians, but what are we, as a board and as administration, as a health department of this county, doing for all these families, the children that don't have well visits because they won't take a vaccine.
So we did talk a little bit about this, and what we're trying to do is to determine if there are any in the county, put a list together of that resource. I know
There's
Tammy
not
said
any.
she's been looking, and there's not.
There's
and
not.
So, yeah, we have one, doesn't take insurance, but.
Well,
they're-
that's my, yeah.
Yeah.
There's concierge. I know there's a Webster. There's one in Webster and there's one in Waterloo, but there's not one pediatrician that will accept insurance that you can't be vaccinated. Now, if you want to pay out of pocket and pay cash for a visit, there's doctors, there's 2 that I know of that will see you. But anyone and that's on Medicaid, Medicare, whatever the state assistance or any kind of private insurance, they will not see a child.
What about immunizations for school? Would she consider getting him shots to start school? Because those protocols are still in place for vaccinations.
Well, he's 7 weeks old, so we got a while to
I mean,
go
later
there.
on down the road.
I don't know.
Now, you said, if I remember correctly, you said you were working with representatives?
I had talked to her, but the bill had gotten, it didn't even really go anywhere. It won't, but with Holly, it didn't really go anywhere, even get to, I'm not sure all the legal wording, even get a hearing
Should
on
we
it, I
send a-
believe.
Okay, I'm sorry. Should we send a letter of concern to Department of Health up here in the state over this matter?
I can talk with some of my contact with the state to see what they're hearing and with other health departments. I mean, we
Just-
meet, we have a routine monthly meeting, a lot of us discuss, so I can bring up that topic if see anybody else.
If you don't mind, I think that'd be try and make this a little bit of a concern, because it is concerning that they're not being able to be seen.
And I think St. Louis County, I mean, we've even checked into that far, and it's pretty much all across the state.
Yeah. Anything else on that topic? No, not hearing any? All right, next one is entertaining any topics for the next agenda. Does anybody have any topics wish to move forward? Not hearing any, we're going to step to the next one, although this will happen after a closed session, as the notes say. This will be act on the method of sale for our former health building over at 405 Main Street in Hillsborough. So that'll be after close, if anybody wants to stick around or stay back or come back. We'll have that. Next on our agenda is closed session. I need a motion, please.
I'll make a motion, move into closed session.
Second.
Having a first and a second, is there any discussion on the matter? Not hearing any, and this is pursuant to 610.021, confidential and privileged communication between the Board of Trustees and Jefferson County Health Department and its representatives and its attorneys, leasing, purchase, or sale of real estate. These records are closed and protected by law. Roll call.
Mr. Pig?
Yes.
Dr. Henry?
Yes.
Ms. Stidham?
Yes.
Mr. Deal?
Thank you. Yes.
Sorry. Ms. Taylor?
Yes.
Thank you, and we will come back after the closed session, so thank you.